Josh, I feel like every time you come on, I ask you a similar question, which is there are states in the U.S. that see the number of infections rising. Is it too late to stop it? How do they do it? And why do they not have a handle on it yet?
So there are many states in the United States where it is not a good situation, where cases are rising and there is just an enormous amount of community transmission, and there are a lot of people at risk. I think we're in this situation because states opened quickly and people really felt like the virus's threat had passed when it had not. I think that really getting control over the situation in these states is probably going to require a greater degree of, closing down certain things. I don't think it has to be a stay-at-home order necessarily, but I think to see where the virus is spreading and in those locations, not give the virus that opportunity, like particularly places like bars, which have just been the source of outbreaks all over the world.
Okay, what do we know about schools reopening in September in the U.S.?
Well, this is now quite a contentious issue, with some people saying it doesn't look like kids get that sick, so what's the big deal? And other people saying, well, some kids do get that sick, and of course you have teachers and staff in the schools, and we have to be careful. I think that the right answer is a middle ground, where you're looking for areas where the virus is under control first, and then the schools take reasonable steps, like have been taken in other countries with pretty good results. So the challenge is when people, take these extreme positions, it's really hard for people to instead work together to find a solution in the middle. And frankly, you need resources for that solution in the middle, and those have not been forthcoming.
Josh, for our international audience, who decides what schools reopen? Do they have extra funding to make sure that there are, things in place? One of the points that you're making, is it up to the federal government, or is it much more local?
Well, the decisions on whether to open in the United States are pretty local, and they'd be down at the county level, not even at the state level. The resources generally have to come from the federal government because of the way the government's funded. The states have to balance their budgets, and it's the federal government providing money for the pandemic. They provided some money in one of the early pieces of legislation, but not a lot has reached schools. In some areas where the money has gotten there, it's gone for things like food, extra food for kids, and maybe some tablets or computers to bring home. But it's a lot more, because we're talking about needing more space, needing more staff, needing more buses. Things like that really do cost money, but it's a worthwhile investment. We need kids to learn. We want them to have the protections and social development of school. It's just really important for the pandemic not to cast a huge shadow over our society, for kids to be able to go back to school, but they just can't if it's not safe.
How close are we to finding a vaccine? I know we're expecting, this trial with the Oxford vaccine to come to fruition. There are a number of trials. Are we close to something, or is it just very small steps towards something that could be promising?
Well, I think what's good is that we haven't been derailed yet. There are all kinds of problems that could have happened so far that haven't happened, and we have multiple candidates getting into large trials, multiple candidate vaccines, so that's another good sign. But truthfully, you just don't know. A lot of these early vaccine studies are with new types of vaccine platforms that we really hope are going to work, but you just don't know until you do the study. And so hopefully there'll be, well-run studies. That means the patients will get enrolled quickly, and we'll be able to see very quickly whether they work and get a good measure of their safety. So, I believe Dr. Fauci when he says he's cautiously optimistic.